measurements in right heart catheterization and Swan-Ganz catheter. Again, I'm just going to talk about the relevant one, the one that I've seen cardiologists and cardiac surgeons use it when they have a Swan. Of course, they will have a continuous right atrial or CVP monitor on the screen. This will be continuously monitored. And CVP basically similar to the right atrial pressure. The difference basically, the CVP we measure the column, pressure column just in the superior vena cava just above the right atrium, and it's literally the same. So this is continuously monitored on the screen. Clinical relevance, we'll talk about it later on. Right ventricular pressure, this is only one time reading during insertion, so you won't see anything on the screen saying, oh, right ventricular pressure, because it's just measured during insertion and it's only one time reading. Pulmonary artery pressure, this is a continuous monitoring on the screen. You will see that on the screen continuously the numbers of pulmonary artery pressure. And the pulmonary artery wedge pressure or occlusion pressure, it can be done whenever we need by inflating the balloon, doing the wedge, right? Again, in clinical practice, even this we don't do it much. We rely on the estimation of the LVEDP by looking at the diastolic pressure of pulmonary artery. I'll come to that, because the whole course of this is immerse you in the real life clinical experience that we live in the hospitals, not the life in textbooks. And from the occlusion pressure, we measure the LV, left ventricular end diastolic pressure. Again, we'll talk about it later on. And also we can, by the thermodilution procedure that I think there is a thermodilutor part of this catheter can measure the cardiac output and indirectly cardiac index. And again, we'll come to that in further details. Here, simply, this is the waveform. When the catheter enters the right atrium and the right atrium contract, this is the A waveform, if you remember these waveforms. And then you have this descent here, the right atrial pressure waveform. This is right atrium until here. So basically here where there's, I think, the tricuspid valve open, and then close, with the right tricuspid valve close, and then we have the passive filling. This is the V here. Again, I don't want to go in details. Really, in clinical practice, real life experience, I don't recall when was this. Oh, the V is giant, V wave is giant, or A wave is giant. Really, we look at the whole clinical picture. There's many other easier way, and this is real life experience. But just to let you know, and this is when the right ventricular pressure, when the systole, the RV contract, increase the RV pressure, and then descend. That's when the pulmonic valve open, and this is the pulmonary artery pressure. This is RV, and this is pulmonary artery goes up, and this is when the pulmonic valve, I think, close and the pressure drop. And this is the left atrium tracing, because when you do the wedge, basically, or actually, it's just the blood will be pumped from here to the left ventricle eventually, so it gives you some tracing of that. Again, go and memorize it maybe for the exam's sake. I'll show you soon what do we do in real life practice.